Hey guys, it's Ryan. This video we're going to talk about dynamic occlusion, and this is when the jaw is moving. And if you haven't watched the first video on static occlusion, go ahead and watch that now. I'll try to leave a link or something you can click on for that. So we're going to revisit a drawing that we talked about in the first video, and this is where we have the left side of the mouth on the left side, the right side of the mouth on the right side. We have lingual on the inside, buccal on the outside, and this is sort of like a cross section through the molars. And let's say you're chewing gum on the left side of your mouth. Which way is your mandible going to move? So it's going to move to the left, right? So in this case, the left side of your mouth is doing the work, while the right side is just kind of hanging out. So when the mandible moves to the left, everything on the left is experiencing working movement, while everything on the right is experiencing non-working or balancing movement. So probably the simplest way to remember it, and this is like a super complicated thing, but if we can boil it down to the simplest way, if the side matches the movement direction, then that side is experiencing working movement. If the side does not match the movement direction, then it's experiencing non-working movement. All right, awesome. So there we go. And balancing is the same as non-working. So let's zoom in on the left side again and go back to our Twin Peaks diagram from the first video. And let's color it up a little bit. So our blue dots and our pink dots here represent our centric stops. And if we move to the left, try to imagine this like lower element moving to the left with the upper one being stationary. And you can imagine which surfaces will touch. So it's going to be the ones in dark purple here are going to grind together if we move this tooth to the left. If we move it to the right, you can imagine that these two lighter purple surfaces will touch together. So again, this is our working movement, and this is our non-working movement, and these are the surfaces that will would likely contact, given this scenario, would likely contact in with that direction. So this is left side of the mouth. Moving left is working, moving right is non-working. All right, and this is like how we can translate from what we saw coronally to a more axial or occlusal view. And this is where we basically have two ranges of contact where the lingual cusps of the uppers are contacting in the central fossa and the marginal ridges of the lowers, and then the buccal cusps of the lowers fit in to the central fossas and the marginal ridges of the upper teeth. And so this would be sort of how the whole thing looks together. So that's a pretty cool way to try to envision this view being translated into this view. And they're saying the same thing. All right, so this is the coveted Occlusal Grid, and I also adapted this from Past the Dental Board's YouTube channel. So again, go ahead, check him out. And basically, each box is a tooth. So each box here represents canine to molar, to the second molar, and then each box down here, the same thing. Each number refers to a contact point. So if you label it from 1 to 13 here, and then it also translates to 1 to 13 down here. And so this is referring to that lubule, the lingual of uppers, buccal of lowers. It all correlates. And so it's really pretty neat. And this is basically the right side of the mouth. You can see how the upper teeth are just displaced halfway towards the buccal, just like they are in real life. And so this is basically a picture of the right side of the mouth. And so if we were moving to the right, it would be working. Moving to the left, it would be non-working. But we're going to first, before we dive into all the working and non-working stuff, I want to talk about this view. So here's a picture of the maxilla, and we're looking up at the roof of the mouth. And so here are the mandibular fossa. That's where the condyles would sit. And so the patient's right is actually on the left side of the drawing, and the patient's left is on the right side of the drawing. And if the patient moves to their left, then by definition, the left side is working and the right side is non-working. So notice how the condyle on the working side pivots, while the condyle on the non-working side slides down the articular eminence. So ironically, the condyle on the non-working side is actually doing more of the work, but that's just the nature of the mandible, because it's one bone with two joints that are forced to work together. So now in this case, which side is working? Well, because we're moving to the patient's right this time, everything on the patient's right is working. Everything on the patient's left is not working. So now I want you guys to notice how the working movement, which is this arrow here, it basically represents a mandibular cusp grinding against this maxillary tooth during the movement. And notice how the working side movement is straight out towards the buccal, while for non-working movement, it is sort of, the arrow is sort of oblique, and it's like diagonal. And that's because the center of rotation, in the case of non-working movement, is the opposite condyle. So if you were to take one of those like old school protractors and put one point here and then sort of turn it around this way, you'd see how it curves obliquely there and how it points more straight out for the working. So that's a really crucial point. Could be a cool thing to play around with, but that's sort of the best way I can explain how the working and non-working movements look that way from the occlusal view. And now to complete the trifecta of dynamic occlusion, here is protrusive movement. And so because the mandible is again doing the functional movement, these cusps, the mandibular cusps, will move anteriorly as both condyles move forward and down their articular eminences. So we're going to revisit the occlusal grid, and we're going to put all the arrows and stuff on this diagram. So our working movement, so this is the maxillary teeth up here, the mandibular teeth down here. This is sort of like distal this way or posterior. There's mesial or anterior this direction, and lingual and buccal. And again, this is just the right side of the mouth. The left side of the mouth would be somewhere over here. But you only have to really draw one side of the mouth for all of your questions that you get. So the working movement for the right side of the mouth would be moving to the right. So we're going to have that there. And the non-working, like we just saw in that pretty much exactly the same thing we just saw in those previous pictures, non-working is going to be an oblique arrow this direction because of the opposite condyle being the center of rotation. And then the protrusive arrow is going to be straight ahead. Now, the exact opposite directions are used for the mandible. So we're going to have protrusive this way, working this way, and non-working this way. So it's like exactly opposite of the maxillary. And so how does that was a little confusing, but why does that make sense? So because the mandible, like as the mandible moves forward, the maxillary cusps, which are stationary, actually move backward relative to the mandible moving forward. That's why everything is projected in opposite directions onto the mandible. And hopefully that makes sense. You might have to like run that through your a couple times, run that through. It's super complicated. It's kind of confusing, but I promise the more you practice, the more it'll start making sense. So let's do some practice problems. Here's a picture, and we basically have two ways we can solve this. We can either convert it to a sort of word problem, use the occlusal grid, or because we're given a picture, we can solve it directly on the picture. So we're going to do both methods and see kind of which way works best for you, and then you can use that moving forward. So this question asks, which cusp contacts here at this point during static occlusion, and then during dynamic occlusion, what movement does this arrow depict? So if you want to go ahead and try to solve this on your own, pause the video, and if not, we'll go through it together right now. So the first thing to figure out always is where you are in the mouth. If you're given a picture, where the heck are you in the mouth? So this is going to be the upper, this is going to be the maxilla, the left side, and the tooth in question here is number 14. So this is critical to sort of solving this problem. The next thing to determine is what cusp will contact here at this red dot. And so we can use the fence for this. So we can use our picket fence from the first video, and you'll find out it's the mesiobuccal cusp of number 19 will be contacting here. The last thing to determine is the arrows. So we're given one here, and straight out to the buccal for the maxilla, we should give you a clue that this is working movement, which means that because this is the left side of the mouth, it is working. So this movement would be left lateral movement, left lateral excursive movement. And then if we were just to kind of draw the rest of the arrows for fun, the protrusive arrow would be pointing this way towards the mesial, and the non-working would be pointing like oblique kind of this way. Okay, so I have this kind of cool shortcut for you guys. I'm warning you, if your brain is like packed to the brim right now, just mute me for a couple seconds. But if you want to hear what this shortcut is, you can keep tuning in. So whenever you're looking at a picture like this, a quick way, and this only works with pictures, a quick way to figure out which cusp is contacting at this point, at any point, instead of the occlusal fence, instead of the picket fence, is, so you would find this point, and then you would basically move distofacial in an oblique line. And so you'd see, oh, this is the, what is this? The mesiobuccal cusp of the first molar. And that's what's contacting right here. It's the mesiobuccal cusp of the first lower first molar. So what about here? What's contacting the distal marginal ridge of the upper first molar? You move distofacial, and it's the mesiobuccal cusp of the second molar. And that's what's contacting right there. And you can do this for any point. I just basically pointed all the centric stops here. You can do that for any point, and it works. And the reason is you're basically taking advantage of the fact that the maxillary arch is staggered to the mesial 1/2 cusp and to the buccal 1/2 cusp from the lower arch. So again, this is like shortcut, totally optional, but it's pretty cool. And then basically if you were looking at a picture of the lower arch, you would just move to the mesial lingual at a diagonal, and it would tell you what's contacting there from the upper. But anyway, shortcut, totally optional. Don't worry about it if it's confusing. All right, so let's practice using the occlusal grid. I think this is really helpful, again, in exams and in board situations. So let's give this a shot. So if the mandible is moving to the left, the buccal cusp of the right mandibular second premolar may contact what cusp? All right, so again, if you want to go ahead and try this out on your own, you can pause the video. If not, we're going to go through it together right now. So the first thing to do for this question is to locate the cusp. So this would be referring to, if it's the buccal cusp of the right mandibular second premolar, so it's good we're on the right side, and the mandibular second premolar, that's going to be number 4, contact point number 4 right here. The next thing to do would be to find where it occludes in the opposing arch. So then we're just going to go ahead and find number 4 on the upper. And the last thing to do is determine the movement. So because we're moving left and we're looking at the right side of the mouth, the side does not match the movement direction. So we're talking about non-working movement. So we can draw in this non-working arrow right here. And so it will hit the distobuccal surface of the lingual cusp of the maxillary first premolar. And that's pretty much it. It's pretty cool. I mean, that's pretty much the basic gist of how this thing works. So yeah, I mean, it's a little bit complicated, a little bit confusing, but this is all you have to do is basically locate the cusp and then translate it to the upper and then draw in your arrow for whatever movement they're referring to in the question. All right, so let's keep going. In a right lateral excursion, the mesiolingual cusp of the maxillary second molar passes through what structure? Okay, so again, let's start out in a systematic way. The first thing we do is locate the cusp. So we're going to find the mesiolingual cusp of the maxillary second molar. And then the next thing we're going to do is find where it occludes in the opposing arch. So we'll circle number 11 down here. And the last thing to do is determine the movement. So because we're moving to the right, and this is the right side of the mouth, then that means that the side matches the movement direction. So it's going to be a working movement. So we can draw in our working arrow. And if we want to figure out what structure that's referring to, this is the second molar, this is the lingual side. So this would be the lingual groove. So basically this cusp is traveling through the lingual groove of the mandibular second molar. And that's it. Let's try one more. So in a left non-working movement, the mesiobuccal cusp of the right maxillary first premolar will pass through what structure? So the first thing to do is locate the cusp. So now we're talking about the mesiobuccal cusp of an upper tooth, and you'll notice we don't have those marked in because they're not the functioning cusps. But we can sort of figure out, we can extrapolate where it's going to be. So if this is the mesiolingual cusp of the maxillary first molar, we just move out this way, and we figure it's going to be somewhere in this, somewhere in this vicinity. And so we would we're kind of between 6 and 8 here, so we're going to move the circle right over here. And then, of course, the last thing to do is determine the movement. So what is non-working on the left side is working on the right side. So basically, for all intents and purposes, the left non-working is the same as right working. So we can draw in a working arrow, and it will pass through, you'll see, the mesiobuccal groove of the first mandibular first molar, and then it goes through like the central pit, central fossa area. And that's it. So that's basically how you use this thing. You can pretty much apply it to any of these sorts of questions. Super handy, pretty easy to memorize, and just reproduce on your test paper. Now, you'll notice there are some limitations to this. I just want to point out, you may notice there's no distal cusp for the mandibular first molar. You can sort of imagine it being somewhere between 8 and 10. But it's very unlikely that you'd be asked any question about the distal cusp anyway. All right, guys, sorry it was a longer video, but just wanted to cover a lot of stuff. In summary, we did the Twin Peaks diagram for the coronal view, the picket fence diagram for the sagittal view, and finally the occlusal grid diagram for the axial view. And that's everything. And I think if you have these 3 tools at your disposal, you will absolutely wreck any occlusion question you ever get. And that's it, guys. So thanks so much for watching. Please leave a like and comment if this video is helpful. Subscribe to my channel and feel free to ask me for any more things that you'd like me to cover. Thanks so much for watching, guys, and I'll see you all next time.